Good morning, Virginia. This is Virginia This Morning.
These Partners in Healthcare segment is sponsored by Hospice of Virginia.
We all want the very best for our loved ones, but if the time comes that those dearest to us fall terminally ill, who can you turn to? Hospice of Virginia focuses on living and offers a team of specialists that help ease patients' suffering and pain and provide comfort. Provider Relations Coordinator Leslie Alsing joins us this morning. Thanks for coming in.
Thank you for having me this morning. I appreciate it.
We were talking a little bit before we were on about how you discovered this as a career, and it's very rewarding for you, and you've been with it over 10 years.
I have. I've been with Hospice of Virginia for 10 years, and I became a Provider Relations Coordinator right from the beginning, and part of that is community education. And it is what I passionately do every day, is make sure that people understand that they have an option at end of life, and that often our medical community doesn't give all the options, but people need to know that they have options and that they have choices.
What are people, in your experience, surprised to discover with hospice?
Well, I think the biggest thing they discover is the amount of support that they get with hospice care. It's like no other kind of care. You get a whole team of people. You get a registered nurse who will always be your same nurse, and they're going to visit you several times a week. You're also going to have a home health aide, which can be a huge burden off of family members in trying to provide that personal care. And so they will also visit you several times a week. In addition to those two, you have a volunteer who we just love our volunteers and are always looking for volunteers who can come and be with the patient, let the family maybe go out and get their hair done or go do some grocery shopping. Volunteers can run a vacuum or help in any way that makes your day a little easier. In addition to those, you also have a social worker and spiritual care. So it is a whole person kind of approach to care.
It's definitely comprehensive, and it gives you the opportunity to live life. And I know that sounds maybe a little contradictory, because it seems that people often think of hospice at end of life, but it gives the opportunity to create a comfortable living.
Exactly. And you know, I meet with families every single day and help them to understand that we can't avoid end of life, but we certainly can avoid how end of life happens for us. And we know that 90% of the population has long progressive illnesses that we have time to prepare. And so we should make sure that we have all the information and all the options. And hospice is one of those that helps people to face end of life with dignity and comfort and peace.
Now, Hospice of Virginia also is unique in the sense that it offers an inpatient unit, which is unusual.
Yes, absolutely, and that is one thing that sets us above the rest. Hospice of Virginia has been a very strong entity in this community since 1995, and we service 72 plus counties, but our biggest asset certainly is our dedicated inpatient unit that's located at Retreat Doctors Hospital. It's a 15-bed unit that is designed for that intensive end-of-life care, and it encompasses the whole person. So all the entities of hospice services are at that unit so that the patient and the family are supported through that very difficult time.
Well, Leslie Alsing, thank you very much for introducing us to Hospice of Virginia.
Thank you.
Appreciate it. We'll share some information. You can learn more about the benefits of hospice care by visiting them at 7231 Forest Avenue in Richmond, or give their team a call at 281-0451. And you can always visit online, hospiceva.com.